Welcome to Lyme Support Network podcast, where we bring together voices from across the Lyme community, doctors, advocates, warriors, and coaches to share knowledge, stories, and hope. Today, we are honored to have with us a leading voice in the fight against Lyme disease, Dr. Mass, an integrative Lyme specialist. Dr. Mass has dedicated his career to uncovering the root causes of chronic illnesses and helping patients navigate the complex world of tick-borne diseases. In this episode, Dr. Mass will help us explore the challenges of early Lyme diagnosis, breakthrough approaches in treatment, and how lifestyle and environment and patient advocacy play a critical role in healing. Whether you are a patient, caregiver, or simply seeking clarity in a sea of conflicting Lyme information, this conversation is for you. You can, Doctor, you can introduce yourself and share with us how you started as a Lyme specialist.
So the way I started to be a Lyme specialist is about taking care of one family member. When I was at the ILADS is the International Lyme and Associated Disease Society, the organization that teaches doctors about Lyme, the lecturer asked the question, who had personally Lyme or who had a family member who had Lyme? And all the audience, made of hundreds of doctors from all over the world, rolled the hand. Not one kept the hand down. They said to understand why some doctors do Lyme, why they are Lyme doctors, why they dare to challenge the medical authority by taking positions that are not according to the standard of care, is because they refused to abandon their children, their spouse, to a diagnosis of life term with sometimes loss of medication and not so much of resolution. So we end up looking at the medical literature. We are trained to do that. We know how to do that. And we discover that there are some controversies, and we get trained. And we become a Lyme doctor because we realize that if we don't do that, people are left to their own fate.
Okay. So what I would like to know is, what makes Lyme disease so difficult to diagnose early in the early stages?
Okay, so there are really two questions in one question. To answer very simply is to say that it takes time for the body to produce antibodies. And everybody agrees. We know there is a controversy over Lyme disease, but there are some points where there is no controversy. And the CDC himself warned that don't do a blood test within the first 2 months of a tick bite because the chance of having a blood test positive is so low. It can be misleading. The second point that I would like to emphasize is that there are basic rules of medicine that are not really taken into consideration with Lyme. And we will see that over this podcast. The first consideration is that if you want to do a diagnosis of infectious disease, you do a culture or you do a PCR. If you have a sore throat, you don't give your arms for a blood test. If you have a UTI, you don't give your arms. You give urine. If there is a wound, you do a culture. So why we don't do that with Lyme? Because where do you want to park your swab? Can you drill a hole in the brain to do a brain culture? You cannot do that. Lyme can be everywhere, can travel all over the body, can be in the muscle, in the heart, in the brain, so in the liver. So where do you want to do a culture? It's just impossible. Sometimes it's possible because people have a joint effusion, but most of the time it's not possible. So we have this second choice diagnostic tool, which is a blood test. And since we do that all the time, it becomes routine. We forget that it's a second choice test. And this is the reason why it's so difficult to diagnose Lyme, because it's difficult to make antibodies at the beginning of the Lyme disease, but afterwards it's not so easy either. The
Mm.
Lyme disease is an immune suppressant disease. The Lyme bacteria play games with our immune system, and many people are not able to make antibodies to
Mm.
the point that, ironically, I can tell you that Lyme doctors who have lots of experience will tell you, sicker you are, more chance you have to have a normal blood test. And if you show up to my office with 10 positive bands, I smile silently, but I know it's not Lyme. You are too healthy to have Lyme. So it's just the opposite of what people may think. Why? Because Lyme is immunosuppressant. It's like taking a drug that is immunosuppressive drug, and you check the antibody to see if the drug works well. It's a nonsense. So
Mm.
blood test is not only difficult early on, is always difficult. It's just that early on, everybody agrees about this.
So, doctor, so how does your functional medicine approach differ from the traditional care, and how it is more is having an edge over the traditional?
Okay, so uh, it's a big question, and I will answer in a very short way by an example. I
Mm.
would say like this, is that if you want to buy a house and the salesperson uh, tells you that because you saw a crack on the wall, and the salesperson tells you, I promise I will hire the best plaster and the best painter, and you will not see anything of the crack. You say, I want this. I really want a painter and a plaster, but I want an architect. I will not buy a house without understanding why there is a crack on the wall. Maybe the floor is not flat. Maybe the roof will fall apart in a few years. Maybe there will be another crack. I want to understand why. This is the obsession of a functional medicine doctor, not just to treat the symptoms, but to understand why, to go to the root causes of the problem. And I say root causes plural because the main idea of the conventional medicine to say one disease, one cause, one treatment falls apart with functional medicine. We understand that in chronic diseases, there are most of the time multiple factors that contribute to the disease, and we have to dig, and we have to unveil all of these factors and to treat the root causes. Also, in the reading of blood test, of testing, there is what we call optimal versus within normal limits. Very often, blood tests show nothing. It's not in bold character, it's not in red, and it's normal. And a functional medicine doctor will jump on the chair to say, oh, it's not normal. Why? Because it's not optimal. And this is where the word maybe functional uh, comes into play, because we are more functional to understand what is best for the patient.
So it is more like what exact root cause. You go to the root cause, you clear the root cause, and ultimately the disease will go off.
Yes.
So that is the approach. Yeah. So that
Yeah.
means you will be using multiple tool sets to do this.
Correct. Yeah.
So from multiple across multiple modalities, you may be using it. Toolkits from multiple modalities.
Mhm.
Okay. So, doctor, so what are the first signs people should look for after a tick bite?
Okay. So the classic sign of a Lyme disease early on I mean, is very well known. Is Boldar's rash, is fever, fatigue, back pain, knee pain, joint pain. These are the signs that we see early on. I would like to say that there are a Lyme doctor like me sees two types of Lyme disease. There is the early sign of Lyme disease that all practitioners see. They are well familiar with that. They will tell you Boldar's rash, and there are doctors like me who see more chronic Lyme patients. And chronic Lyme patients, I can tell you that I would like to tell you there is less than 5% of my patients that have a Boldar's rash. It will be incorrect. I think it's maybe even not 1%. Many people do not recall this famous classic presentation that I've just mentioned. So, very important to know is that after a tick bite, things can be unnoticeable. Lyme disease may happen 24 hours after a tick bite, may happen 25 years after.
Mm.
So, yeah.
So the virus goes dormant in our system?
Yes. Yeah. There is one point of your question which is very important that people should know about it. That there is a tick-borne disease, we will speak of co-infection in a few seconds, called Rocky Mountain Spotted Fever. It's due to rickettsia. And usually it happens like a flu-like syndrome. Why we should know that is because it can be fatal within 24 hours. This is Lyme disease is very rarely fatal, I have to say, unless it attacks the heart, but it's really very rare. But Rocky Mountain Spotted Fever is the big threat when we deal with tick-borne disease. So when someone has a flu-like syndrome in July today, don't think it's the flu. It looks like the flu. You better have doxycycline immediately, even if you don't have a blood test. Actually, it's so serious that doxycycline, as you may know, doxycycline is not given to children before the age of 9. This is a rule. But the American Academy of Pediatrics said that for tick bites, they allow doxycycline because doxycycline and azithromycin are the only medications that work well for Rocky Mountain Spotted Fever. And for that, there is a risk of death. Amoxicillin will not work. Penicillin, cephalosporin will not work. So a child who has a tick bite and later on develop a flu-like syndrome, you have to give doxycycline immediately. It works very well. The threat of death is really eliminated by doxycycline. So it's something really that we have to mention.
Okay. See, doctor, the rashes is the most mentioned or quoted symptom for Lyme. Is there a possibility that a patient can get Lyme and they don't show the rashes?
So when you look at the medical literature, the frequency of the rash is very variable according to studies. You can see 80% of time, you can see 23% of time. In my practice, I have 1% of times. It's very important to tell people that we speak of Lyme, and everybody speak of Lyme, but it's just a lay language. A Lyme doctor think of tick-borne diseases, all the diseases that are transmitted through tick bites. And the Lyme disease is only 30% of all of them. The bacteria of Lyme is called Borrelia burgdorferi, is already very difficult to pronounce. You don't tell people I have borreliosis, you said I have Lyme. Now, if you see all the strains of Borrelia that we have, Borrelia mayoni, Borrelia MC, Borrelia so many Miyamoto Borrelia, so many strain of Borrelia. So you say Lyme, and you have Anaplasma, Ehrlichia, Babesia, Bartonella. You have so many bacteria and even parasite or viruses that can be transmitted together with Lyme, that Lyme is only 30%. And we have to know that Bordetell's rash is only present with Borrelia burgdorferi, with Borrelia miyamotoi, and the Lone Star tick. So you have only 3 types of a tick bite that causes a Bordetell's rash. Anaplasma, you don't have. All of other Borrelia, you have tens of other Borrelia that do not have the rash. We tend to associate the Lyme rash to Lyme, to diagnose Lyme through the rash. The rash is very often missing. Of course, if you have a Lyme rash, according even to the CDC, you make a diagnosis of Lyme. You don't need a blood test. This is very important. Some people do know that. If there is a Lyme rash called Bordetell's rash, you do not need a blood test. You treat according to the CDC.
So, doctor, which test do you rely most for diagnosing Lyme?
So, the same test from Quest, Bioreference, LabCorp has different yields. So it's not really the test that matters, it's who does the test. There is a test, the ELISA test. You know that the current rule, standard of care is to do 2 tests, an ELISA test, which is a screening test. And if the test is positive, you confirm with a Western blot or immunoblot, which is your question. The best test is to do Western blot, or best test is immunoblot. It's more accurate. The ELISA test is a very poor quality test. And many people have this ELISA test, screening test, and the test is negative, and the doctor follows the guidelines and does not ask for a Western blot. So I always do Western blot. I may do ELISA or not, but I will always do Western blot, and it depends on the lab, of the quality of lab. The best things to understand is that there are controversy over Lyme disease, and we interpret Lyme disease tests with different ways. But where do we have this strength to challenge the medical authority to say, oh, he may have Lyme despite of what you call a negative test? Where do we have that from? We have that from co-infection. Because when you have a test, a questionable test, you can always argue, and you may be right, and you may have strong reason to challenge me. But if I find that you have a questionable Lyme, maybe you are positive for tick-borne rising fever, you are positive for anaplasma, you are positive for rickettsia, you are positive for Babesia and for Bartonella, and quite often people have 5 or 6 infections. So then you know that the questionable Lyme disease test is no longer questionable. But if you have only 1 Lyme disease test, what do you want to believe me, rather than your other doctor who just look at the rule as there are, and they tell you there is no Lyme. So the most important reliable test is a comprehensive test. Never do only Lyme, do all co-infection. Is from there that you will have evidence of a tick-borne diseases.
Okay. So after getting a tick bite, if suppose I know I got it, so what do you suggest to do the next immediate steps?
Okay. The tick bite, the tick, you have to remove it. And you should not use any alcohol or to burn the tick. You have to press gently the tick and to exert a pressure upward with a tweezer to remove the tick. Now, once you have the tick, what do? Or the CDC tells you don't send it to be identified. Why? Because even if the tick is infected, it's not sure that infects the person. This is what the CDC said. Some others will say it's better to know than not to know. So if the tick carries Babesia or Anaplasma, there is more chance for you to have that, and we may target a better prevention. So, saying that, there are three attitudes in face of a tick bite. The first recommendation is from the CDC. The CDC tells you that if you find a tick that was attached for more than 36 hours on your skin and you are still within 72 hours of the tick bite, take a single dose of doxycycline, but a double dose, 200 milligrams of doxycycline, and that's it. And you will not have Lyme. Great. This is the CDC 101. This is what the health department tells you, what infectious disease tells you. This is the national recommendation. The second attitude that we see, which is the most widespread attitude, and that is what I hear, is that the doctors will say, wait and see. If you have symptoms, treat. If you don't have symptoms, forget it. Mm-hmm. The second recommendation is ILADS, and I guess you know that I'm an ILADS member, so I will, of course, follow the ILADS guidelines, is to give not less than 1 month of doxycycline. So there is a big problem here, because you don't treat, you prevent a disease with 1 month of antibiotic, and you tell me that the treatment of Lyme is 3 weeks of doxycycline. It's not possible. What's going on? So we have to review the three recommendations. The first recommendation is what all your auditors will hear from their doctors, a single dose of doxycycline. You have to know where it comes from. It comes from a study in 2001 published in a New England Journal of Medicine by Dr. Needleman, who took people who had a tick bite and they looked for 6 weeks. They followed these people for 6 weeks. Did they ask them, are you tired? Are you depressed? Do you have joint pain? Do you have a depression? Do you have back pain? No. Do you have a bald ass rash? Since the most reliable for them sign of Lyme to say it's Lyme, because back pain, you don't know if it's Lyme. So they chose purposely to use a reliable marker of the disease, bald ass rash. So they give you 200 milligrams of doxycycline on the first day, and they ask you to come, and after 6 weeks, you are discharged from the study. So this study tells you that 200 milligrams of doxycycline guarantees only one thing: you will not have a bald ass rash, like 90% of people who have Lyme, or maybe less. But and second thing, what happened after 6 weeks? Nobody knows. So Alan Steer, the doctor who discovered Lyme disease in Connecticut in the town of Lyme, writes that Lyme disease, neurological problems of Lyme may occur 14 years after a tick bite.
Oh my God.
So if you want to wait and see symptoms, like the doctor says, you have to say, do I have to wait 14 years to know if I become schizophrenic or not? So yeah. So you don't know. So 6 weeks is not enough to guarantee anything. Also, they did not look for fatigue, headaches, pain, only bald ass rash. So this is the limitation of this study. The second attitude to wait and see is, I don't know, is a doctor who made up that one in his office and people copy him. This has no ground, scientific ground. There is no studies that support such an attitude that allows a disease to happen. It's not preventive. The third recommendation is ILADS. So why? Because the sooner you treat, the better it is, the better outcome it is, because the bug is not yet disseminated everywhere. So you have a better chance to eradicate Lyme. The thing here is that if you tell me, if I have a tick bite, what is the chance for me to be sick? I tell you, how many people in America had a tick bite last year? Impossible to know. Impossible to know. How can you make a ratio if you don't have the top number? Many people do not know they had a tick bite. Maybe it's the scalp, maybe in the back, maybe it's just a dot. So it's impossible to know. So when you want to get an antibiotic for a sore throat, you want to have a throat culture. You want to know if you have a strep or not. And here you want to take antibiotic for 1 month. You need to know if you have Lyme or not. If you be sick, but tough luck. We tell you, sorry. I cannot tell you what is your chance to be sick. So now, if I know because my tick carries Babesia or Lyme, what is the chance for me to be infected? CDC tells you maybe you will not be infected. We know it's not sure. It's likely, but it's not 100%. Now, if I have the bacteria in me, what is the chance for me to be sick? What do you mean by sick? A headache over 1 week or to be crippled for 35 years on a wheelchair? I don't know. So there is not I don't know. What we know is that the CDC admits that 10% of people who have Lyme will not be cured. Will not be cured. We disagree with 10%. Many people are misdiagnosed. Many people do not go to the doctors. And studies bring up to about 36% of people who had Lyme who will not be symptom-free. So the CDC will tell you, maybe I don't want to digress too much, but the CDC will tell you is post-treatment Lyme disease syndrome. That they say, yes, we admit that 10% of people will have joint pain, even encephalopathy for months, for years. And which treatment for that? The CDC writes on his website, unfortunately, there is not yet proven treatment. But I don't want to digress too much. The problem is that ILAS knows how nasty Lyme can be. And I'm sure that you remember of HIV and in the 80s. You remember how many people died from AIDS? So if someone had the needle stick or had an encounter with someone with HIV, and you tell him, oh, it's not likely that you have, or you have some antibodies, but not a lot, it's not significant, but you have some antibodies, but not to qualify as positive, you don't need a treatment. You cannot accept that. You want 3 antibiotics for 1 month because you know how severe, how deadly, how devastating can be the disease. So when you know Lyme, you are scared of Lyme. And when you have a tick bite, you want the best prevention. It's not according to numbers, it's not according to statistic. If you want to take 1 month of antibiotic because you want to have a proof, I'm sorry, but I'm the wrong doctor. I can just testify of what I see, how life can be shattered, how people can be schizophrenic, bipolar, depressed, have pain for 30, 40 years because of a stupid tick bite. For that, I want the best. And I will follow the recommendation of ILAS to use at least doxycycline for 1 month.
Okay. See, doctor, so what are some of the biggest mistakes patients make during the treatment?
Okay. When you asked me this question, I was thinking if you ask me the biggest mistake that doctors make, but you ask me patients.
Yeah. So let us explore both.
Okay. Well, from patients is too much supplement, too much medication. It's too expensive, or it's too much. I cannot swallow all of this, and they start to shorten the treatment, not to be compliant, not to follow the treatment as it's written. This is the biggest mistake that people can do. Now, the biggest mistakes that doctors do, I would like to say that mistake is not the right word. I don't want to say that Mistake is very negative. It would be looking down to my colleagues, and it's not my purpose. There is a knowledge, there is a science, there is a very new science, and as you may know, science to go to the clinical stage may take a long time, and it's not easy or possible for all doctors to be aware of all the science behind Lyme's. That's why Lyme doctors who are personally involved in Lyme, they got the science because they read it, because they go to look for it. But if you don't have any reason to look for the medical literature, you can understand doctors cannot look at all medical literature. It's just impossible. So it's just a fact that we have to accept without any judgment, that many doctors want to be educated, and they are very welcome to join ILADS to be more educated. The biggest mistake, but what we can do better is to understand that the Lyme bacteria, and when I say Lyme bacteria, I mean all type of tick-borne disease, but we know better with Lyme bacteria. Lyme bacteria exist in three forms. Can be cell wall form, can be intracellular, can be in cystic form, called also round body. And there is one antibiotic for each one. So if you give doxycycline, it's going to work well. You will have some bacteria that will be killed if they are intracellular. If they are not intracellular, it's not going to do anything. But let's say they are intracellular, you have good luck to that. So many survivors will transform themselves into cystic form, resistant to doxycycline. And the round body form are sensitive to flagyl, to other antibiotic, but not to doxycycline. And if you give amoxicillin, which works for certain form of Lyme, the same bacteria have the ability to change its form. The same bacteria has the ability to change its coating, its membrane. So since antibodies are made by taking a picture, 3D of the membrane, to make protein that matches the form of the membrane, since the membrane can change every single day, you can imagine how foolish are the blood tests for Lyme. But let's do like this. When you give one antibiotic, you create a resistant form that the Lyme will change of form from cystic to cell wall form to intracellular. The way it changes that. But this is nothing compared to what I'm going to tell you now. It has been shown about the past few years that Lyme bacteria exist really in two subpopulations. There is the active form, the form that makes you sick, and when you kill them, they are survivors. And survivors, they decide of a strategy to resist to the doctor. So what they do, they reduce the metabolism to the strict minimum. They hibernate. They fake to be dead. Initially, we call them survivors. Now they have a name, persister cells. And these bacteria are resistant to all antibiotics except for Dapsone. More than that, these bacteria hide themselves in biofilms, a type of a spider website, like a bunker, like a fibrotic sphere, where they are inside, and these spheres are not penetrable. So all medications that you give to your patient will bounce back on the wall of the biofilm. And when it's safe, when you stop antibiotics, and when the bacteria feel that it is safe around, they go out and they reactivate themselves to explain why there is relapse. And what I'm telling you correlates very well with what we hear. What do we hear with Lyme disease? We hear that I took a medication for 2 weeks. It was wonderful. I feel much better. And on after 2 weeks, relapse, or after 6 months, relapse, or and keeps relapsing. So some doctors who will, I heard that, will tell you that you get a stick bite every 6 months or every 2 months, but or you realize that it's just a relapsing disease because the Lyme bacteria exists in these two forms. So not giving only one antibiotic can alleviate Lyme, cure absolutely not. Can resolve the symptom for a time, yes, because you kill the active form, but you create an army of resistant forms. By giving one antibiotic, you have just created a monster. You can say, you can imagine, I don't know if it's true, but let's say like this. You can imagine that you have a tick bite, you have a little bit of fever, your immunity will be okay. We'll take care of your Lyme bacteria. Because you took doxycycline, now you have created what we call chronic Lyme disease, because you have created a response from the Lyme bacteria to transform themselves into persistent cells. Without aggression, you would not have had this reaction.
So by taking the antibiotics, you are telling that we have changed the bacteria's state. So two type of stages they were, and you have changed the state in which they will start changing their shape, and they will stop responding to our medicines.
Yes.
So how do you treat patients with both Lyme and mold toxicity?
First, this question is very interesting. Why? Because we estimate that in 80% of times, mold is associated with Lyme. Because mold is very common, and Lyme is very common, very simple. But the point is that someone suffers from mold, and everybody in the family looks at the person like a crazy guy because it's the only one who complains of mold, and everyone is under the same roof. They are not sick. I say yes, because you don't have Lyme. She or he has Lyme. That's why mold has a grasp on him. Lyme is immunosuppressant, mold is immunosuppressant, so Lyme and mold activate each other. And that's why the worst case of Lyme is, we estimate that 80% of time there is some mold involved. So your question is, of course, very important, because when we treat Lyme, we look for other associated factors, aggravating factors. Lyme is rarely alone. That's why Lyme patients differ a lot from one another, and mold toxicity is a biggie. So in my training, I asked this question to an expert. I will not give his name. I don't know if you would agree. And I asked him, if you have mold and Lyme together, what do you do? And he told me, I treat both. And I said, but he will never know if the patient suffers of mold and Lyme. He said, who cares, as long as it's better. So I understood that it was sarcastic, but I understood that after 30 years of practicing Lyme and being one of the leaders of Lyme, that he wanted maybe to tell me, you will never find out if it's more mold or more Lyme, so just treat. When we asked this question, Dr. Neil Nathan, who is one of the top leaders in the mold world, and he said mold first, and he explained, and he agrees with the other doctor to treat both. But he said like this, that mold people may be very sensitive, and mold people and Lyme people may not tolerate both. So if you want to start by something, start by mold. So my take on this is to say that if someone is very sensitive, very toxic, you start by detoxifying. Can I say something in addition to that?
Yes,
Can I
please.
add something?
Yes, yes.
One of the major problems of Lyme treatment today, from a Lyme doctor's perspective, is not to heal patients. Today we have bombs, we have treatment, and we can have time. We have to review the newest weapon that we have for Lyme to the point that is no longer a concern, really. Everything is God's hands, but I would say that by experience, the success rate is phenomenal compared to 5 years ago. The concern is Herxheimer reaction. Herxheimer reaction is what? Is everything is as if the Lyme bacteria would release toxins from its belly randomly, usually, and the Lyme goes by flare-ups, so chronically, but by the release of toxins. This is spontaneous due to the bacteria. Now, when you take a gun and you shoot the bacteria explodes and release all of its toxins into the body. You have just provoked a flare-up of Lyme. It's called Herxheimer reaction, and is when people come to see you because they have a knee pain or headaches, and they take doxycycline and they have a much worse knee pain, and now they cannot walk, or they are so tired, and they have all these Lyme symptoms that emerged that become worse with the treatment. So we said, this is a Herxheimer reaction. And some people will tell you this is the best proof that it's Lyme. Because if you are depressed and you take doxycycline, which has nothing to do with psychiatry, and your depression is worse with doxycycline, or if you take Z-Pak, and you become totally psychiatric with Z-Pak, you ask your doctor, he would tell you, in 30 years, I've never saw that. Okay? If you have Lyme, you have just caused a Herxheimer reaction. So the aggravation of your symptom is actually the way the bacteria tells you, yes, I was there. You kill the bacteria, now the toxins of the bacteria are out, and you have an exacerbation. And this is a concern because when someone has a knee pain, he has a Herxheimer reaction, he may have such a knee pain that he cannot walk. Someone who is depressed, anxious, or psychotic, if he has an aggravation, he may find himself in the emergency room. It's a psychiatric emergency because he may have a psychotic episode, hallucinations. So we are very careful when mental problems occur with Lyme, with a Herxheimer reaction. When Herxheimer reaction happens typically 2 weeks after the beginning of the treatment. But it may happen on the same day, or it may happen 2 or 3 days after. So why there is a difference is because if you are toxic, if you are full of pesticide, glyphosate, you are full of plastic, of mercury, lead, your body struggles to clean himself. Now you come and you pour a bucket of dead bodies of bacteria, it gets overwhelmed and you herx. We say herxing. We have created a word to say that it's so common. Herxheimer reaction is very common. So sooner you have a Herxheimer reaction, more toxic you are. That's why we like to detoxify before or with the treatment to minimize the Herxheimer reaction. So now if you come and you have mold, and depending how much of mold you have in your body, if you live in a very moldy environment and you are already overwhelmed by mold and by many mycotoxin, which are the toxin produced by mold, if you take a Lyme treatment, you may just not do very well. So that's why to answer your question, is a correlation between the toxicity, how toxic you are, and how Lyme, if you allow me this expression, you are.
Okay.
Ultimately, you need to treat both.
So, how important, doctor, is lifestyle to the recovery of in the recovery of Lyme?
It's very important. Very important. Lyme is a fire in the body, and A fireplace can be very cozy, can be very nice, but if you bring oxygen tank and gasoline around, you may regret to have done that. So Lyme is a fire, is inflammation due to infection, and anything that bring inflammation feeds the fire. So lack of sleep, we know that lack of sleep increase interleukin-6, which are cytokine mediators of inflammation. So we know that lack of sleep causes inflammation. We know that food can be inflammatory. I spoke about dairy, about sugar, about gluten. So light exercise is actually good for Lyme, not strong exercise, but light exercise. So lifestyle stress also may affect the body. So a Lyme patient needs to have a healthy lifestyle. And of course, if he eats products that are not organic and is already toxic, so then he add.
Yeah. And what about the families and caregivers? Can play what role they can play in the healing process, apart from having a support or moral support? What else the family and caregivers can?
One word: validation. Validation. When people are told all is in your mind, all is in your head, when they have denial, if it's not mockery from doctors, so they turn towards their parents, their family members, and they get validation. Suffering is terrible. Now, being denied the reality of your suffering is intolerable. And I think that financial support is way behind that. Validation is really what we have to keep in mind today.
And so, what advice do you have to someone who feels dismissed by other doctors? So usually this happens.
If I have to tell, the patient have to write a book. Yes, this is terrible thing. This is terrible thing. I remember a lady who saw 9 infectious disease doctors. Only the last one thought of Lyme, and she saw a cardiologist. Or the cardiologist told her, word by word, I repeat, "I don't care of your Lyme." And so I explained to her that she was not crazy. She was not crazy. She was Lyme, and she was crying.
Yeah.
Things that telling me she's not crazy. She's not crazy, and it's very difficult because she was convinced that she was crazy. So yes, to be told that you are crazy, it's mental is difficult. So there is what to do when a doctor dismisses you.
Yes.
This is a very big question. I can tell you that the problem is that if I know a subject, because I studied the subject, I'm ready to discuss with you. If I know the subject, or because I pretend to know the subject because I just repeat like a parrot what other doctors say, and because the other doctors have the merit to have some initials behind the name, you cannot discuss. It's such a prejudice, so bias. So you cannot really, it's impossible that you, board certified in family practice, can even dare to say a word contradicting infectious disease doctors. They just, I even don't want to go in any further with you. How can you dare to do that? So you cannot really do things. And there is, I have example, or a doctor did not even acknowledge the healing of patients. Uh, of patients. So having a patient who came for bipolar disorder, and this 19 years old, and the mother said, we don't have any bipolar in the family. She cannot have bipolar. And the psychiatrist did diagnose the bipolar, and she was on lithium. And so we did test, and I treated for Lyme with azithromycin. And 1 month after, the bipolar was really gone. 2 months, she was okay. She was fine. The psychiatrist no way to stop lithium. And so I reduced lithium by myself, but I was scared. I'm not a psychiatrist. So I did in 6 months what he would have done in 2 weeks. And after 6 months, she was no longer on lithium. She saw the psychiatrist who said, I quote, "It's a miracle." He said it's a miracle because she did not have any more bipolar disorder. He admitted that she did not have any more. But he did not believe in Lyme, he preferred saying that it's a miracle. You cannot really realize. If you want to discuss with doctors, and I think there is a point of discussion here that we can bring in podcast, because I want to give you the opportunity to hear what you never hear. Okay.
Yes.
Yeah. This is what I think interest for your podcast to hear. So the way to, now you have to sit well, because I'm going to give something very interesting. The way to diagnose Lyme is to have bands. Bands are protein attached to the membrane of the bacteria, like pearl, okay? And you have 10 bands. And the CDC tells you that to have Lyme, in IgG, you need to have 5 bands out of 10. And IgM, you have to have 2 bands out of 3. What about if you have 1 band out of 3? You don't have Lyme, but have migratory joint pain, have night sweats, I'm tired, and nothing works. I have 1 band. No way, Jose. You cannot have Lyme. Go home. You don't have Lyme. No, I have 4 bands and a half. You don't have, and I'm serious. Many of your people who are listening to us will relate to that. The doctor said, no, Lyme is negative. Why? Don't have 5 bands. So you stand up and you said, doctor, with all my respect to you, why 5, why 3, why 2, and why 5? Why? Because the CDC said so. But once again, why? The CDC says so. They certainly know why. But you know why. So you will probably hear silence, and you say, I'm going to do a favor to you. I'm going to tell where it comes from. It comes from Dr. Dressler in 1993, I think, in the Journal of Infectious Disease. And I can give you the name, the article. Dr. Dressler and colleagues, as we say, did a study, and they said, we wanted to have a test specific of 90% for epidemiologic studies. So we decided that by raising the number of bands to 5, we will eliminate all false positive. So specificity for people who didn't learn at school, sensitivity means, specificity means that if you have an alarm at your door, which is very specific, you want only Amazon to be able to ring the bell, for it to be you are notified only from Amazon. It's very specific. You will miss people because it's too specific. You want to have something that catch flies, but not bees. Okay? You will miss flies. It's too specific. Now, if it's too sensitive, if your camera at the door is too sensitive, even if a cat passes by, your alarm will ring. So there is this conception in science, in statistic, between sensitive and specific. So the Dr. Dressler and his colleague wanted a test to know who has, without any doubt, Lyme disease. Their purpose was not to diagnose a patient, is to know how many cases we have in America every year, 476,000. It's for sure verified. Their purpose is not to treat, is to know for sure. So they needed to have a test of such a specificity to eliminate all the doubtful cases. Specificity, for some reason, became sensitivity. The study is specificity 90%, and now the rule is to use the 5 bands as a sensitivity to rule out Lyme. You cannot rule out Lyme with this test. If you know the reason why 5 and why 2 is to know who has for sure Lyme without any the shadow of a doubt, is not to know who does not have. Also, how do you know that the test is accurate? How do you know the test is accurate? How do you know that the doctor who tells you, I don't believe you, you don't have Lyme, the test is negative? How do you know it's so correct? Because Dressler took a group of patients who had Lyme for sure, and they did a clinical assessment. And they verified that people who were positive were also positive from a clinical standpoint. The reference was a clinical assessment, the clinical diagnosis that is today stepped on, disrespected, ignored. Dressler used a clinical diagnosis to validate the test. So this is what you can say to a doctor Y513, and you give the article, and you can also, very interesting, you can go to CDC website and you go to the case definition of Lyme. You will see clearly that the rule of 3 and 5 is for epidemiological purposes and not for clinician.
Yeah.
It's written, you go to the page case definition. If you go to the page diagnosis, you will have the rule that all doctors follow, the ELISA test and the Western blot. But this rule that everybody follow comes from a misunderstanding of the reason of that. It's for epidemiologists. It's not for clinicians. Okay, so I hope didn't go too far.
Yes.
Do you have another question?
So doctor, do you have any other specific ideas or points that you would like to share with our audience related to Lyme? Because Lyme is having a lot of controversies running around. So you're having this much experience and working with the Lyme patients.
Yeah. So
and most of our audience are Lyme patients.
So people should know that the controversy opposed highlights to the CDC and IDSA, and that I want to say very loud and clear that my point is not to say that CDC is wrong, IDSA is wrong, is to say there are two opinions. And I think that all scientists, all people of a good faith should voice their opinion. And when I see a patient, I always say, I'm going to give you two concessions in one. I'm going to give you the opinion of CDC. What is the standard of care? And what is ILAD's point of view? And you choose. I give you an informed, you will have an informed decision. You take a decision if you want to follow ILAD's guidelines and IDSA and CDC guidelines. The point that people should know is that doctors who are not involved personally in Lyme have no reason to doubt the authenticity, the medical opinion of the CDC and IDSA. And it would be even not ethical to discuss medical authority. We do that because we have medical literature, and also because we have leaders, and people should know that For example, if you go to Columbia Hospital in New York, if you go to the Department of Infectious Disease, you will have doctors that follow the CDC at the letter. If you go to the Department of Lyme of Columbia, is led by Dr. Brian Fallon, which is a teacher of ILADS. So you see, under the same roof, people disagree. You have, if you have your blood test in Virginia or in Georgia state, there is an obligation to tell you, do not trust the blood test if it's negative by law. In New York, we are allowed to treat more than 1 month Lyme disease. In New Jersey, we don't have. So this controversy divides the world. It's not that you have on one part fake doctors and good doctors. You have a controversy, and each one has its own reasons that we have all to respect. And you read, you see what you read. It would be great if we can be around a table with IDSS, CDC, and ILADS and discuss this. It is what I really wish. I don't know if it will happen one day, but I hope so. And to discuss. So what we see that the CDC tells you that the treatment of Lyme is 14 to 28 days, and you take only one antibiotic. And they tell you that the NIH studies show that giving more antibiotic do not help. I don't know how, because my both eyes saw differently, but they tell you not to give more than 1 month. And if you have more symptoms after 1 month, if you have more symptoms or if you relapse, it will tell you have a post-treatment Lyme disease syndrome. It's like COVID. We don't really know what it is, probably immunological, inflammatory, but it's not Lyme bacteria. After 28 days, there is no more Lyme bacteria. It's gone. It's gone, gone. And you said, if you're so knowledgeable, treat my PTLDS. So I tell you, but as I told you before, unfortunately, there is no treatment. So you tell me that I've condemned for life and you don't have treatment. Yeah, there is no treatment. We don't have always a treatment in medicine. Okay, so ILADS tell you that Lyme can be chronic. There is a very important point that I would like to make. I know I hope not to take so much time, but this problem of chronicity is at the base of the controversy. And I tell you like this. I tell you that a doctor who tells the patient Lyme is not chronic is a liar. A doctor who tells you Lyme is chronic, you have chronic Lyme, because Lyme is chronic, is a liar too. Why I'm saying that? Is because if I want to know if I have Lyme, if my Lyme, I need to have a culture. Do I have a strep throat? You give me amoxicillin. I want to see, I tell you, my throat hurts. No, it's not possible to have a strep. Strep goes away with amoxicillin in 10 days, but it hurts. No. This is inflammatory. This is immunological. This is not due to bacteria. But why don't you do strep culture?
Okay.
No. You can't. So when someone has Lyme disease, how do I know that you have a chronic Lyme? What I know is Lyme is possibly chronic. What I know is that when we infected chimpanzees and with Lyme, and we gave 28 days of doxycycline, and we killed them after that, and we did autopsy, all of them had a live bacteria. When we do autopsy on people who had ceftriaxone, doxycycline, ciprofloxacin, we see on autopsy Lyme bacteria. So in animal model studies and in autopsies and in clinical setting, we see people who keep relapsing. So I know some people say, you got the tick bite every 2 months, but they keep relapsing, or they have a persistent symptom, and some doctor dare to give 1 more month of antibiotic, and it works. But no, after 3 months, no, it does not. So The honesty is to say, I don't know. I don't know. The honesty is to say, I know that on autopsy, in certain people, it's possible Lyme is chronic. In your case, I do not know. It takes lots of strength and honesty for a doctor to say these three words, I do not know. Rather than, otherwise is all his assumption and deduction. And all his assumption and deduction hurt thousands of people by denying the right to be treated. One more word, if you don't mind.
Yes.
I cannot finish this podcast without speaking of Dapsone. Do I have the time?
Yes, you have. And doctor, our audience are Lyme patients, and each and everything that you share very valuable to our community.
So, Dapsone protocol. The Dapsone protocol is when in 2015, Dr. Richard Horowitz would say that you take 100 milligrams of Dapsone once a day, and for 1 year. If you don't take 1 year, it's not going to work. And he said Dapsone, you have to use Dapsone with doxycycline, with hydroxychloroquine, with Distromax, with 3 antibiotics. And he did that. One day, a patient made a mistake. He took a double dose of Dapsone, 200 milligrams. And the patient got much better. And Dr. Horowitz said, maybe 100 milligrams is not really the dose. So he created the double dose Dapsone protocol. And one day, a patient made a mistake. He took double dose of a double dose. He took 400 milligrams. This patient could have been sick for 15 or 20 years. And what happened to him? He got cured in 4 days. So I repeat, he got cured in, I don't say 4 years, I say in 4 days. So instead of fainting, he understood that it's not a question of duration, the treatment of Lyme, it's a question of dose. And is actually very understandable because holistic medicine has the weakness is not to know the right dose. In mainstream medicine, we have FDA studies, and we know that amoxicillin is 875 milligrams twice a day. And if you give 125 milligrams an infant dose to a strep adult, it's not going to work. So when we treat Lyme with doses that are not effective, it does not work. So we don't dare to give too much. But here the fact is that by mistake from patient, we understood that it was all a question of dose. So Dr. Horowitz published a study, 28 patients, not the simple patient, no patient who got bitten by a tick last summer. Okay, patient who went through hell for 15, 20 years. 27 out of 28 cured. 4 days. So I got interested. I know well Dr. Horowitz, communicate very often with him. And so I started implementing Dapsone protocol in my office. I have already 20 cases of Dapsone. Yes. So I remember.
How is the results, doctor, for that protocol? For the protocol, how is the results?
I don't understand.
Results. The result of
the results.
Protocol.
I'm going to tell you the result. I have a patient who was 17 years old who was the most obnoxious patient, disrespectful, kicked out from his school, many schools, and very, very, very bad behavior. After the protocol of Dapsone, the mother said to me, I don't know this boy, I have a new son. The father said, it's a miracle. He was turning around in my office. He didn't understand. the child became so refined, so polite. Yeah. So another boy like this who was very psychiatrically affected behavior. After 2 weeks, I see him walking in the room like an adult. I shook his hand. He was only 14 years old. So much I was shocked by the change of personality. I have a patient who is well known in the neighborhood where he is because he is on a wheelchair, diagnosed Parkinson, but he has babesia. And I gave the Dapsone protocol, and after 3 weeks, here that he start to get up from his wheelchair, on the wheelchair for 1 year and a half, and people on the neighborhood stopped their car of shock because he was known to be in a wheelchair for 1 year and a half, and they see now walking around the block with a pity is true, walking. This guy who was paranoid, really severely paranoid, known in this neighborhood as the crazy guy. He came to see me and from abroad, cousin lived nearby. And I tell him, the Dapsone protocol is 9 weeks. And no way, my wife and my kids wait for me in the Middle East. I cannot stay here. So we started to bargain. I said, listen, this protocol can be done in 2 weeks, but you take your risk, you take responsibility. He took responsibility. I heard from him 90% better. He's no longer paranoid. The psychosis is gone. How long? 2 weeks. The Dapsone protocol is something that after 40 years of medicine, I cannot believe my eyes. I cannot believe my eyes. Cannot believe my eyes. A patient was 20 years old. He wasn't able to come anymore to my office because he couldn't just get up from the bed. Couldn't stand up. He was so sick. He stopped his studies. Couldn't go to the university anymore. And the Dapsone protocol, it took a lot of time, but he's doing very well now. And I told my assistant to say, if he's healed from with Dapsone, I would believe in Dapsone because impossible. He was so sick, the sickest of the sickest. And so Dapsone protocol. There was a doctor, Dr. Lambert in Tulane University in 2024, who infected mice. And she applied to the mice the Horwitz protocol, the Dapsone protocol. She killed the mice. It's not nice, but she did it. And she cultured them. No trace of Lyme bacteria. At the first study, a breakthrough that showed evidence that Dapsone is able to eradicate Lyme disease. How long it takes? It takes 9 weeks. Why 9 weeks? Because we introduce slowly, progressively the Dapsone. Dapsone is the treatment is really 6 days of 400 milligrams of Dapsone and 600 milligrams of methylene blue wither. So really the treatment is 6 days, but to arrive to third dose to see if it's well tolerated, so we take 8 weeks to do it. I don't hear any complaint. I don't hear any side effect. We were so scared of a Herxheimer reaction that we bumped up all the antioxidant. We don't give 500 milligrams of glutathione. We give 2,000 milligrams of glutathione. We are so scared of Herxheimer to the point that we don't see. My secretary tells me she received no phone call actually of side effect from the Dapsone product. She received more when people take doxycycline and rifampin together than with Dapsone because we use so much of antioxidant, anti-detoxifier that we minimize to the maximum the possibility of Dapsone protocol. If I don't speak of Dapsone protocol, that astonished me still today. It cannot be Today, it builds on my conclusion. Today, when the patient comes with Lyme, I ask the patient, what do you want? Do you want to be symptom-free or do you want bacteria-free? People say, I want to be bacteria-free, of course. I say, wait, but it comes with an invoice. Okay, being bacteria-free means 5 antibiotic protocol, Dapsone protocol. You want really that? You don't have to have that. Maybe just you want to be symptom-free, and if there is a relapse, you may think of Dapsone. If you have a second or third, maybe at the 5th relapse, you want Dapsone no matter what. But now you want maybe to be only symptom-free. And also, Dr. Ying Zhang from Johns Hopkins University tested herbs about 3 years ago, and he found the cryptolepis, Japanese nodweed skullcap, works very well, and they are able to kill also persistent cells. Methylene blue also can kill persistent cells. But we know that on petri dishes. We know in vitro. But the number of patients that became symptom-free without using one tablet of antibiotic, I don't have enough finger to tell you how many times. So it's definitely something playable. People who have Lyme, they need to know the opportunity, the existence of the Dapsone protocol. And they don't have to do that. I'm not telling you everybody should be on Dapsone protocol. I'm telling you that the fact is antibiotics do not cure Lyme. And this is one of the keywords. If your audience wants to hear something, when they get doxycycline, rifampin, amoxicillin, ceftriaxone, if they think that they are getting rid of Lyme, is a biggest mistake. I tell people, you take ceftriaxone IV, you take Cifromix, you take that and that. When you are symptom-free and you leave my office, take my business card. You will call me one day. So, to eradicate Lyme, you can try with herbs. You can take your chance. It's not proven. It's not because it's not proven that it's not going to happen. So this is very fair to say that you take Japanese nodweed, Chinese skullcap, cryptolepis. Okay, this product that worked very well on Lyme and co-infection. You can take your chance. And if it does not work, so then you can take antibiotics. And if you want to eradicate Dapsone, it's just a question of how soft I want to be. I cannot be soft and efficient. Softness and efficiency do not rhyme. Not only in Lyme, in medicine, they don't go together. If you want to have a soft, a short treatment and cheap treatment, you take a chance to have a failure.
How many patients you treated with this protocol? And
Today, about 20.
Okay.
About 20. So it's on one hand, it's not a lot. On the other hand, the success rate is unbelievable.
Okay. Fine. So, doctor, we'll conclude this discussion in that case.
Okay.
Yeah. So that brings to the end of this deeply insightful conversation with Dr. Mass. We hope today's episode shed light on some complex layers of Lyme disease and offered guidance for those searching for answers. If you found value in this discussion, consider sharing it with someone who might benefit. Every sharing helps raise awareness and brings us closer to the world where no one has to suffer from in silence. My heartfelt thank you to Dr. Mass for his expertise, compassion, and ongoing commitment to the Lyme community. Until next time, stay informed, stay hopeful, and stay connected. Thank you, Doctor.
Thank you.
So, Doctor,
Yes.
So we want to introduce this protocol, about information about this protocol to our audience. So,
Yeah.
yeah. So in what way we can do you have an article or article so that we can publish it in our website or share it in our
Yes,
social?
yes. Actually, I have a treatment guide of Lyme that I can send you.
Yeah, yeah, that'd be
Okay.
great. Yeah,
Okay. Very
that'd
good.
be great.
Okay. Okay. Bye.
Bye.